Hello everyone. So today I'm going to be presenting the bill that I chose from the Tennessee General Assembly website for 2026. This bill is essentially prohibits TennCare from covering gender-affirming care, and it is HB 2498 and SB 2118. So to begin, HB 2498 is actually is sponsored by Representative Capley, and SB 2118 is sponsored by Senator Lowe. So as this bill was introduced, the exact explanation taken from the Tennessee 2026 General Assembly says that, as introduced, prohibits the division from providing coverage or reimbursement for a medical procedure performed on or administered to an individual if the performance or administration of the procedure is for the purpose of enabling the individual to identify with or live as a purported identity inconsistent with the individual's sex, or treat purported discomfort or distress from a discordance between the individual's sex and asserted identity, and it amends TCA Title 71, Chapter 5. So that was a lot, but to explain it in layman's terms, essentially, so it prohibits TennCare from covering or reimbursing any procedure that is performed on someone that is considered gender-affirming care. So a transgender person, say they, in Tennessee, say they are seeking hormone replacement therapy, or any sort of gender-affirming surgery, sex reassignment surgery, anything along those lines, they, under TennCare, this would not allow them to have coverage or to be reimbursed for any of those procedures. However, this does not count for a non-transgender individual in the case of hormone therapy. For example, say a cisgender woman, someone who is biologically born female, is going through menopause and needs to go through hormone therapy. This would not impact that individual, but it would impact a transgender woman who wanted to go on estrogen as part of a gender transition. That would not be covered under this bill with TennCare. So let's continue. So what does Tennessee code currently say about this? As in general, just with TennCare, there are already some regulations that prevent TennCare from being used for gender-affirming care, for covering gender-affirming care. And in general, Tennessee, one of the major legislations in the state of Tennessee is SB 1, which actually took effect 3 years ago on July 1st, and it bans any medical treatment classified as gender-affirming care to be administered or performed on minors. And it was challenged in this case of the Supreme Court in United States versus Skermeti for violating the Protection Clause of the 13th Amendment, but it was ultimately upheld. So with SB 1, essentially puberty blockers, which some transgender minors take to stop the birth sex puberty from starting, to give them more time to consider if they want to go on hormones or if they are want to transition one day. Those are banned for transgender children in the state of Tennessee, as well as any sort of hormone therapy for transgender children who are, reaching like more their teenage years, where they might start to take hormones, 13, 14, 15, what have you. They cannot do that. In the state of Tennessee, you have to be at least 18 to do any sort of gender transition, and it was challenged, but of course it was ultimately upheld. So there were already, even before this bill, there's already some regulations in place for minors specifically, which just said that minors could not transition at all. However, with this TennCare bill, it's not just minors. It's now being used for adult transgender people over 18 and up. Continuing off of that a little bit, so like I said, gender-affirming care is completely illegal for minors in the state of Tennessee, so it's just not an option for anyone under the age of 18. And this includes puberty blockers. However, I think it's really important to note with this that there are exceptions to this, and the exceptions are not for transgender youth. They are for cisgender youth or intersex youth who have, say, certain issues like precocious puberty, where, say, you've got a cisgender child who has a precocious puberty, and their puberty, they're starting to go through puberty at like the age of 9, for example, or really, really young. They could take puberty blockers, which would essentially just hold that puberty off for a couple more years until they were maybe a more appropriate age to go through their natural puberty. So it's not banned for those cases, but it is banned for transgender youth specifically. And this in the case of transgender youth and transition, there are no exceptions. It does not matter if there is a medical provider recommendation or if they have parental consent, which in most states, other states, you have to, for a minor to transition in any capacity, you have to have both of those things: medical recommendation from a recommendation from a medical professional, as well as parental consent, because of course they are still a minor. But in Tennessee, that does not matter. Even with both of those things, it's still illegal. So the fiscal note, I took this directly. If you're looking at the slideshow, you can actually click on it. It's a link. I took this directly from the General Assembly website, and according to the note, it said the assumption is the fiscal impact is insignificant and it will not conflict with existing policies and procedures, and therefore any fiscal impact is estimated to be insignificant or not significant. So I took that from there. And so firstly, I'd like to talk about some arguments for this policy, because I think it's important to understand that, even if you oppose something, to understand the arguments for it, just to get both sides. So some proponents of this bill argue that TennCare should not reimburse or cover these procedures because they are not necessary. They are deemed by certain people as cosmetic in the instance of transitioning, because, for example, when someone with precocious puberty takes puberty blockers, they see it as like a medical necessity, but because gender dysphoria is a mental illness, it's not seen as the same. And so that's kind of why the bill does not refer to individuals with genital defects or any other medical conditions that would require hormone treatment, because that to the people who argue for this policy, those are seen as necessary. So, and why should you oppose HB 2498 and SB 2118? So there are several reasons. The bill, I will say, just flat out was not handled well. I watched the hearing. The TennCare subcommittee didn't verify whether or not TennCare actually even covers gender-affirming care, so they didn't check that before they did this policy. And in fact, during the TennCare subcommittee, when asked if the coverage is already prohibited for these procedures, the speaker only said that it amends a loophole, without actually going into any detail about said loophole. Also, he did not call a witness from TennCare to even verify if they were already covering it. It seems like if you're having any sort of insurance-related bill or any policy based on insurance, you would want a witness from especially the insurance company to, back up your argument. However, that was not the case for this one. Additionally, this bill is unfairly targeting transgender Tennesseans, which is actually number only about 31,000, which is 0.004% of the state population. So this bill is targeting less than 1% of the population of the state. Yet it allows procedures to be covered for other medical issues, but not gender dysphoria, which can be equally severe and debilitating from those who suffer for it. Gender dysphoria is a mental illness, and for a lot of the people who suffer from it, it is debilitating, and it extremely limits quality of life. So this bill is essentially targeting this minute number of individuals who suffer with gender dysphoria and transition as a result, and but also at the same time allowing these procedures for people who are not transgender. And it creates legal and financial hurdles for an already difficult and expensive medical process. Transitioning is not cheap. I don't cover it much in this PowerPoint, but most of these surgeries are in the tens of thousands of dollars, around $85,000 minimum for gender reassignment surgery, and hormones can be upwards of hundreds of dollars a month without insurance, so it's not cheap, and it isn't cosmetic. It is life-saving for many of the people using it, so to make it more expensive and more difficult is very unfair to the small number of the population. And this is disproportionately impacting transgender people who are also low income. Traditionally, many transgender people are low income because of discrimination in employment and lack of resources. So this affects essentially most trans people. And it could also lead to mental health issues for individuals who aren't able to access their treatments, for people who have to go off of hormones for not being able to afford it anymore. Hormones are a very big part of your mental health, so quitting any sort of hormones cold turkey because you can't access them anymore, it very much psychologically and mentally impacts you, and usually in like bad ways. So it's not a good idea to force people off of hormone medications that they've been on for a long time. And social work lens. So I think as social workers, we also need to look at this from that perspective specifically. This bill definitely goes against what the NASW Code of Ethics stands for. 2 of our 6 core values are service and dignity and worth of the person. And service this bill does not provide help and resources to transgender people so that they can reach their full potential. It actually limits their resources and takes them away for people who cannot afford them. Similarly, it doesn't appreciate the individual value of the person. It punishes transgender Tennesseans purely for being transgender. It makes it more expensive for them just to cover their medical treatments. Social workers should not stand for this bill. It goes against the NASW Code of Ethics, and we should not advocate for this. So recommendations, I'm close to getting done here, I promise. So I recommend opposing HB 2498 and SB 2118. Obviously that's, the bare minimum. And beyond that, we should advocate for transgender individuals in the state of Tennessee and the United States as a whole. It is a very small minority group of people, but right now in the United States and in the state of Tennessee is like one of the leading states, unfortunately. But there have been so many bills against targeting trans people, and they make up such a small part of the population. So we really need to be advocating for trans people as social workers and just in general. Also pushing for bills to protect trans people health and their healthcare access instead of limiting or denying it entirely. In general, we need to push for more healthcare bills for all people in the United States. But in the case of this presentation, having more access to healthcare instead of, taking away what little there already is. Also, education. Education is such a powerful tool for literally any minority group or thing that, people fear what they don't understand. So educate people on trans issues. Tell them about healthcare access. Tell them about discrimination, and some of these detrimental identification laws in the state, such as the one in Kansas. Um, speak speak to your representatives, email, write letters to lawmakers, um, and just in general, speak out against this bill and any other bill that discriminates against or limits the rights of trans people in the state. Um, as a social worker, we should not be promoting bills that, you know, target minority groups and take away their rights. That's not good. And so overall, that was basically all I had to say. And here I have all my references I used. Of course, the Tennessee General Assembly website, the Capitol.gov. I used a thing about the Supreme Court case against the Tennessee ban on gender affirming care for youth, the TennCare subcommittee, and some transgender resource groups in Tennessee. So, yep. And thank you so much for listening. And I'm so sorry this was so long. Bye bye.